Watch. When I make things so obvious, I don't go over them. I want to make sure I'm perfectly clear. Watch. The functions of the cardiovascular system. I know if you look at those, and I tell you not to, because it might help you. That's where it is. Those are the functions of the cardiovascular system. Say yeah. Okay, here we go. I'm going to give you an overview of the cardiovascular system just so you understand it. Yeah? And then we're going to get a little deeper into it. All right, first of all, if you get this question, I'll be very proud of you. What is the heart made out of? That's good. And what are the two things that muscle can do? There you go. What's the most important element in muscular contraction? Get out. I heard it. For real? Better write this down. Never forget this. The single most important element in muscular contraction is calcium. You better write this down too. What are the blood vessels, arteries, and veins made out of? Right. My name is? The heart and blood vessels, please get this, rely almost exclusively on calcium from the blood to contract. Are you with me? Yeah? Okay. How many hearts you got? 2 hearts. It's February 9th, so it's coming up. You have the right heart and the left heart. So you have 2 hearts that are actually smashed together, and they beat as one. Ah. You're not feeling that? Okay. Watch. The next thing I'm about to explain to you, if you get this, your life will change. And you think I'm lying. When somebody explained this to me, I'm like, I get this. Now I know why they do that, that, and that. If you don't get it, fries? Ready? Ready? Hang on. Oh, I forgot to erase that. You have 2 types of vessels in your body. Get this now. And we're talking right now about the systemic circulation. Systemic circulation means the vessels that supply the cells of the body. You're following me? You got me? And you have 2 types. You've got arteries and you got veins. Say yeah. You're with me. You know this probably just intuitively. Yes? You know this? All right. First of all, by definition, arteries take, can't see that too good. Arteries take blood away from the heart. What would veins do then? Veins take blood to the heart. All right? Now watch. And get this, because there's a question about the differences and similarities between arteries and veins. I'm going over that one right now. You may want to look at the time. And ready? So watch. Arteries, systemic arteries, number one, under pressure. Boom, 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 boom. Bless you. Number two, they carry blood under pressure that is high in oxygen and low in carbon dioxide. So by definition, it is O2 rich. Arterial blood, systemic arterial blood, is high in oxygen and low in carbon dioxide. Yeah? If you look, this is the thickness of the muscular wall of the artery. That muscular wall of that artery is very, very thick. Why is it very, very thick? Because it's under pressure. And again, the body does stuff that makes sense. Now, because it's under pressure, when you sever an artery, blood spurtulates. It goes, see, yeah. So if you sever an artery or a vein, which will kill you quicker? Severing an artery or a vein? Good. So watch. The body, again, does stuff that makes sense. Do you have veins that come to the surface of your skin? Yes, you have. Look, there's one right there. Do you have arteries, large arteries, that come to the surface of your skin? No. That's because large arteries are deep inside the body where they are protected by muscle. Because if you sever an artery, you bleed to death quicker. Say, yeah. See how that is? However, there are some arteries, parts of arteries that come to the surface. When you take somebody's pulse, you're feeling the radial artery. Tell me you got that. Then you have the brachial artery. That's where you take the blood pressure. Then you have the axillary artery. You just hit that when your arm stinks. You say, hey, are you following me? These are referred to as the pressure points of the body. Let me explain. This is important clinically. If somebody comes up to you, takes a machete, and hacks off your arm like that, would it make sense to try to go and cover all those arteries that are there? Would that make sense to try and stop the pressure that way? No. What you're going to learn is that you take a pressure point, like underneath the arm, and you apply pressure there, and it will cut off the blood flow so that arterial blood stops flowing out of that arm. Say yeah. Now this is really important. You have two carotid arteries that supply your brain. So if somebody has a laceration on their scalp, you take a tourniquet and you put it around their neck. Just keep tightening. Did you hear about the old guy that killed his wife? She was bleeding, and watch. You know this. If you have kids, and when they hit their head, watch. Anytime a kid has a cut on his scalp, it needs stitches. Write that down. So when you get a compression, right, compression injury, it will split the skin. And because the face is very vascular, lots of blood vessels, you bleed like a stuck pig. Are you following? So people get offered, oh, oh. So the guy, he had a first aid class, so he put a tourniquet around his wife's neck. It stopped the bleeding. That's a true story. How could I make that up? How could I make that up? And you seem shocked by that. You don't see, do you ever watch the world's stupidest criminals and stuff like that? I mean, there's some real brain donors out there. And there was one little kid in a pool drowning. He's at the bottom of the pool. So they're like, what do we do? What do we do? One guy yells, don't move him. I'm going to tell you, listen up, because this is absolutely true. The worst time to be in a hospital is June. That's when all the new fellows who graduate from medical school, they start being doctors, playing doctor. So I had this one guy, he goes into a supraventricular tachycardia. One of the things that you can do to slow somebody's heart rate is to massage their carotid artery, right? That will slow their heart rate. So what's old Jasper doing? He's doing this. And the guy's like this. Eyes are rolling the back of his head. I'm like, it's only one side, dude. Yeah. You know what? I just quit sometimes. I hope like when I'm 80, I'm hit like a big bus or something. Just splat. You know what I mean? Because I don't want to be like in a nursing home. Oh. Yeah, but I want to spend that money. That would make no sense. Robbing a bank and then getting... No, I'm going to make... If I make it to 80, I may rob a bank, right? Because what if I get away with it? Right? Okay, are you ready? Guys, watch. Watch. What are the two things that muscle can do? That's beautiful. So watch. You better write this down. Arteries are referred to as the resistance vessels. Please get this. Please get this. Oh, I did this. Here's an artery. What's it called? The hole that the blood flows through? The lumen, right? So if you were blood, which would you rather flow through? Artery A or 2? Why? Just read that. There's less resistance to blood flow. Tell me you got that. Arteries that are smaller have more resistance to blood flow. So I'm just going to tell you this. It's not going to make a lot of sense, but it will later. Doctors control blood pressure by controlling the diameter of arteries. You got me? How many people followed that? Not really, you don't. All right? Okay, if you get, oh, this is, I was going over this in my advanced class, and I looked at them again, and I said, you have no idea how good this information is. Because I was explaining it, I'm like, this is brilliant. And look what I'm making. I should be at Harvard. Here we go. I want to show you that. Oh, that ain't good. See, I got to stop talking. Don't ask me any more questions. Hang on. All right, watch. If you get this, I'm going to be proud of you. I'm going to explain to you systolic and diastolic blood pressure. I know, you look at that look you gave me. Like I can't believe that he's actually going to explain that. No. Yeah, that was a look. I've had that look many times. How many people know what systolic and diastolic mean? Well, help a brother out. Tell me. What does it mean? Right. We'll do better. All right. I think I told you this. Did I tell you this? That this is going to be the first question on the quiz? And if you get this wrong, your whole quiz is wrong. I told you that, right? Did I tell you that? I'm telling you that now. Right? If you get this question wrong, and it's going to be the first question on the cardiovascular quiz, if you don't get this right, I'm marking that whole quiz wrong. And here's why. Let's say that through the grace of God, you matriculate through Gateway and you become a nurse, right? And then the patient, you're taking their blood pressure, and the patient says, hey, what do those numbers mean? And you go, I don't know, I got that one wrong. This is fundamental. No one leaves this class not knowing this. Say yeah. Here we go. Which side of the heart pumps more blood? The right or the left? They pump what? That's right. So watch. You better write this down. The left side of the heart, the left side of the heart, the left heart, we'll go into more detail in a little bit. That sends, that pumps oxygenated blood to the cells. And it's under pressure. Now watch. When the left side of the heart contracts, it ejects blood into the systemic arteries under pressure. Are you following me? The pressure measured. Where do they usually measure it? That's right. That's why I had you do the body diagrams. Remember brachial? So wherever those spots are, that's where arteries are. So guess where your brachial artery is? Right here. Where's your popliteal artery? That's why I had you do that. See? It's the pressure measured typically in the brachial artery. And systolic blood pressure. Systolic blood pressure. Systolic blood pressure is the pressure that's generated and measured in the brachial artery when the left ventricle, the primary pump of the body, contracts. Say yeah. What does muscle do? It contracts and relaxes. So what's normal systolic blood pressure measured in the brachial artery? It's 120 millimeters of mercury. It's measured in millimeters of mercury. Say yes. Is there any pressure in the arterial system, the brachial artery, when the left ventricle is relaxed, not pushing blood? Right. So you better write this down. Diastolic blood pressure is the amount of pressure measured in the brachial artery, when the left ventricle is relaxed. And what's the normal diastolic blood pressure measured in the brachial artery? It's 80. So that is systolic and diastolic. And people say, well, which is more important, systolic or diastolic? And your answer is, they're both important. That's the answer, right? Because they don't really know. And here's the other thing. People are going to say this to you, and all you can do is look at them and smile, just go. Right? They're like, hey, Tim, can you check my blood pressure? I go, why? Well, I got a headache. If your blood pressure was 130 over 80, and then your blood pressure went up to 160 over 80, you ain't going to feel nothing. Nothing. It's called the silent killer. It doesn't, you will not feel it. Do you understand? Unless, of course, your systolic blood pressure goes up to about 400, then you'll start feeling it. But most people's blood pressure doesn't get up to 400 because by then they start drooling out of the side of their mouth. They have a nice little stroke. Tell me you got that. How many people are with me? Okay, here, this is really important. Watch. If you get this, I don't even want to talk about it. Form and function. What is the thickest vessel, blood vessel, you have in your body? The aorta. Because the aorta, you better watch this, the aorta comes right directly off the left ventricle. So it carries the highest pressure. So it will have the thickest muscular wall. Are you following? As that blood, that arterial blood that's under pressure, matriculates from the large arteries and the small arteries down to the capillaries, what happens to the pressure inside those vessels? drinking problem. That's why I made it a point of saying this a million times. How thick are capillaries? Can a capillary withstand a pressure of 120 millimeters of mercury? No. Good. So what happens to the pressure in these arteries as you move farther and farther away from the heart and get closer to the cell? It goes down. Say yeah. So watch. When you get down to the level of the capillary, the pressure in that arterial capillary, you better write this down. Better not pout. Is about 10 to 15 millimeters of mercury, or about 10 times less than it was coming out of the aorta. Are you following me? And that oxygen that's in the arterial end of the capillary is going to go sit at the end of the electron transport chain. Ain't that right? And what's going to come out of the cell? Carbon dioxide. And that's going to go from high to low. And arterial blood becomes venous blood. That's why it's called circulation. It's a circle. Say yeah. All right, watch. You really need to think about getting this tattooed. I'm thinking about maybe making a bumper sticker out of it and selling it to you guys for $29.95. Watch. There's no pressure in the systemic veins. No pressure in the systemic veins. Is there any pressure in the systemic veins? No. See, yeah. You got that. For real? Okay, here we go. And once you get this idea, it's going to be amazing. All right, I'm going to pick on some people. Jessica? I'll pick on somebody else. Okay. A pregnant woman is told to lay on what side of their body? That wasn't very, convincing. Is it the left or the right side? Why is it the left side? I'm going to explain this to you, and boom, it's going to all come together for you. I'm going to do a little beating, too. These are my ghetto, what are they? Beats. I think somebody had like a cat or something that had those. Every time I put them on, I get allergies. All right, here we go. I know, leave me alone. If I fall. Are you ready? You ready? What? Is my toe alive? Good. So does it need arterial blood with oxygen to go down to it? Yeah. That's good. So when it gets down to my toe, what happens to the pressure in the arterial end of the capillary? Decreases. It goes down. And when the gases are exchanged and that blood becomes venous blood, there's no pressure in the systemic veins. Say yeah. All veins of your body return that blood to the right side of the heart. If there's no pressure in the veins, how does that blood, that venous blood, get back? The muscle, because the muscle contracts and relaxes. Then how do people who are paraplegic get blood back to the heart? Or quadriplegic? Oh, it's magic. You don't know this. You don't know this. But every once in a while, and it goes unrecorded by our brain, you will actually stand on your head. You will do it. You don't even know you're doing it. You don't even see me doing it, because I got to get that venous blood back to the right side of my heart. Ain't that right? If you get this idea, this is no joke. Have you ever heard of congestive heart failure? Yeah. Have you? You will begin to understand congestive heart failure. Yeah? Oh, hey, when somebody is losing a lot of blood and they're making their bleed themselves their own blood, what are they told to do? Yeah, what else are they told to do? For real? Hold what? How are you most days? Right. This class sucks. I'm taking an MATC. You follow? Is there any pressure in the veins? So watch. When you go down, you store a lot of extravenous blood in your legs. So if you're bleeding your own blood, they'll tell you to elevate the person's legs, because there's no pressure in the veins, and all that venous blood will come back to the right side of the heart by gravity. That's why in a hospital, that's Spanish for hospital, yeah, or nursing home, they have a little clip on the bottom of the bed, at the foot of the bed, that can put the people on their head. When their blood pressure drops, you put them on their head. Ain't that right? I'm going to explain to you why. And now you're going to learn something. Say, yeah. That's what I mean. How good this information is. At break, everybody, leave a buck 50 up there. Not even 20. You're going to. I'm going to explain to you why this stuff is important, and you're going to get this. You are.
Don't forget your mind.
It's all about you, huh?
Mm-hmm.
Right. See what I mean? Twizzlers all day. I'll write this down. As a matter of fact, I'm not even going to write it down. I'm going to just say it, and you're going to write it down. I was told by one of the ladies who's in administration, she said to me, Tim, when you're doing more work than the students, something's wrong. So I wrote that down. Any pressure in the veins? The veins, I'm going to write this down because I like saying this. Capacitance. Capacitance. I got it. Capacitance vessels. What does capacitance mean? The ability to, oh yeah, I'll just tell you. The ability to hold extra blood. Tell me you got that. Are you circulating through your arterial system right now all of your venous blood? Are you, yes or no? Why not? Nice. And also, if you were to pick a bloody booger and you lost blood, your nose would bleed a little bit, then you would pass out, because if you needed all of your blood circulating all the time, you lost blood, you wouldn't have enough blood to circulate. Say yeah. You couldn't donate blood. It wouldn't make a lot of sense. I'm going to go donate blood and then die. So do you have extra blood? Where do you store that extra blood? What are the capacitance vessels? The veins. I'm not even kidding. Better write this down. And the largest veins of your body that hold extra blood are deep inside your leg muscles. Are you with me? Yeah? Remember when you were a kid and your mom bought you Freezy Pops? She put it in the freezer, right? And then every 10 minutes you go there, and it ain't done, and it ain't done. Then you forget about it because you're probably reading the textbook. And in the morning, you pull one out because it was frozen, right? The purple ones, those were good, right? You bite off the plastic, yeah? And then from the bottom, you would start pushing it up. But if you didn't hold it there, it went all the way back to the bottom. And then you kind of cried, huh? You didn't cry? Okay, good. You guys are strong. I want this whole thing. I'm going to explain to you one way that venous blood gets back to your right side of your heart if there's no pressure in the veins. How many people are following me? Guys, I wish you knew how good this information was. So if you get into clinical and you need to do good in this class, and you ask me a question, I'm just going to walk away. Here's dude. Where are the largest veins of your body that store extravenous blood? Deep inside your muscle. You better get this. Veins have one-way valves. And these one-way valves only open up towards the right heart. Tell me you got that. Where are the largest veins of your body that store extravenous blood? Good. So watch. When you walk, what do? You contract muscle. You got me? And when you contract that muscle, it squishes those veins like a Freezy Pop. And that venous blood that used to be down here, watch it, now down here gets pushed up towards the right side of the heart. And when you relax the muscle, the valve will close, preventing that venous blood from falling all the way back down. Tell me you got that. Isn't that cool? So if you ever watch The World's Greatest Beaches, when they got that 65-year-old guy who's tan between his toes and he's got a Speedo on, no man should ever wear a Speedo, ever. He's got this kind of ratty, nasty-looking veins on the lower part of his leg. What are those? They're varicose veins. And the reason they're ratty and nasty and knotty is the valves get stretched out. That's the valve getting stretched out. And when the valve gets stretched out, they can't return that venous blood back to the heart. That's why people with varicose veins get swollen legs. Say yeah. How many people followed that? How many people have ever had abdominal surgery? How many people would like abdominal surgery? I'll do it. Did I ever tell you that my buddy, he's a plastic surgeon in The Two Stupid People? Yeah, I did. Okay, watch. Watch. Write this down. Better not pout. No pressure in the veins, yes? You got me? Is there pressure in the arterial system? Is arterial blood always circulating? If your heart's beating, arterial blood's always circulating. Is venous blood always circulating? No. And blood that does not move, venous blood that does not move, tends to what? Tends to clot. Tell me you got that. So watch. The most painful surgery that you will ever have is abdominal surgery. When they cut you open, ouch. If you have chest surgery, the ribs and the sternum will support you. Muscle, they have to cut through the muscle to get through your guts. So how do people breathe when they come out of abdominal surgery? Like that. Do you want to get up and pop a lock right after your abdominal surgery? Do you? No, you don't. So watch. One of the things that they'll do after surgery is they'll come in and they'll give you a little shot right there. What is that? Right. It's an anticoagulant because doctors are worried about coagulating. Are you following me? Because doctors know that patients who have surgery, especially abdominal surgery, don't want to move. Say yeah. Also, coming out of surgery, they have sequential compression devices on. Those are those big boots that inflate and deflate, and that mimics. Say yeah. Are you following this? So watch. Anybody been on a long, long flight, like to maybe Milwaukee to like Antioch or Zion? Where'd you go? Okay. They would tell you every couple hours, get up and move around, huh? Not for your comfort. They could care less. They don't want you dying on their plane. That's a fact. So watch. If you are sitting on your fatty acid for 8, 10, 12 hours, venous blood doesn't move because you're not getting up and squishing that venous blood. And venous blood that doesn't move has a tendency to clot. Tell me you got that. Now watch. I'll tell you later. Watch. This is disturbing to me. It is. It's disturbing because people don't listen. So blood that doesn't move tends to clot. In this video, it looks like a marshmallow treat with some certs with Redsin inserted in them. This is a blood clot. You got me? A blood clot has a name. It's called Ralph Pierre. This is called a thrombosis. Yeah, it's in a vein, right? And where are the largest veins? Where? Deep inside. That's why it's called a deep vein thrombosis. You learned something here tonight, whether you like it or not. You got a clot. So you were sitting on the plane doing nothing, not even reading the textbook. Two. And then you get up after sitting on your fatty acid, not moving your legs for 12 hours. Now when you get up, you formed a deep vein thrombosis. When you get up, you will start to contract and relax your muscle. And that thrombus can take off. A moving thrombus is called an embolism. A deep vein thrombosis can embolize and cause a stroke, right? I'm going to give you guys a pass because you don't know any better, right? 4-semester students said deep vein thrombosis can cause a stroke. And you know what I did? I almost stroked out when I heard that. You're going to learn the circulation of blood through the heart. And when you learn that, you know that a deep vein thrombosis can't cause a stroke. Are you with me? Here we go. Write this down, never forget it. The veins of the body, as they get closer to the right side of the heart, get bigger. So when this clot breaks loose and becomes an embolus, is this clot going to block any of the veins on the way back to the right side of the heart? No. And this is no joke. If this happens to you, well, you'll know what's happening and it's over. When that embolus breaks off, or when that thrombus breaks off and embolizes, it's not going to block any of the veins on the way back to the heart. There it goes, that little marshmallow treat. Oh, oh. And this is no joke. When you get a deep vein thrombosis that starts to embolize, it will actually light up. And you're like, oh, here we go. And then boom, it's over before you. Wouldn't that be cool if that did happen? Watch. Will that clot block any of the veins on the way back to the right side of the heart? It's going to go to the right side of the heart. Watch it. Watch it. Who's watching? Are you watching? Why is this moving? This sucks. Okay, watch.
Your heart
Yeah, big wow. Here we go. Here comes all that venous blood coming back to the right side of your heart. You got this clot here. Oh, that clot's going to move into the right side of the heart big. The right side of the heart sends that blood to the lungs. What happens to the size of the vessels as you get deeper and deeper into the lungs? They get smaller. That's why a DVT causes a PE. A DVT causes a pulmonary embolus. If it's big enough, you die instantly. Say yeah. Have you seen people routinely walk around like this? Where they don't move their arms at all day. Have you ever seen that? Good. So people don't develop clots in the veins of their arm because what are they doing? For the crowd. They're moving their arms, but not all people are moving their legs all the time. Tell me you got that. So what they will do, in people who have a propensity for the development of deep vein thrombosis, I'm glad that was recorded. You know that sounded good. What they will do is they will put a little umbrella in the inferior vena cava. So if any clots come, that umbrella catches them before they can cause a pulmonary embolus. Tell me you got that. How many people followed that? Yeah, until the day they die, whichever comes first. Say yes. Okay. Now you're going to get schooled again. You ready? Any pressure in the vein? When you have a baby, where does the baby grow? On your neck. Where? Grows in your belly, don't it? Tell me you got that. I'm writing that down. Look what I learned in class today. Is there any pressure in the venous system? No. So watch it, if you lay on your right side, the baby and the abdominal organs will compress this big vein because there's no pressure in it. Ain't that right? So you will not be able to get any blood back to the right side of your heart. That's bad for you and the baby. If you lay on the left side, arteries are under pressure, and it will take the baby and the weight of your organs off the abdominal vena cava, so venous blood is able to return to the right side of the heart. That's why pregnant women lay on their left side. It don't matter. You still just got schooled. Now watch. Watch. What do pregnant women develop?
Fat. Right.
What do they develop?
Babies.
Right, I'm definitely writing that down. What do they get that they don't like? And they get? And?
Acid reflux.
Well, we're on the cardiovascular. The baby's growing in here. The baby's growing in here. No pressure in the veins, right? Venous blood normally moves this way. But when the baby compresses that abdominal vena cava, it's going to put pressure on those valves. That's why they get varicose veins. Did you get that? Vocabulary to the maternal. You have no idea how good that information is. Do you have any idea how to get that information? Right. Yeah, you got school. I wish I was my teacher. Killing me. Follow that? Yeah. Okay, here we go. What's one of the ways that venous blood gets back to the right side of the heart? And what do veins have that arteries don't? They have the, right. If you don't include that in your answer, I'm clearly marking that wrong because you didn't learn. Veins have one-way valves that only open up to the heart. And when that vein gets squished, it'll force open that one-way valve and push that venous blood back to the right side of the heart. Say yeah. Okay, watch. And, uh-oh. Yep. They're a crutch. You know what? I had one student, she admitted it. She goes, Tim, why come to class when I can sit in my bedroom and watch these videos? I go, you're right. Why do I come to class? I can sit in my underwear and make these videos. I'm going to put this stuff online and make a class out of it. That way I could be in like Antioch having a good time. All right? Nothing. No. I always tell people I'm going on vacation. Where are you going, Tim? I go, I'm going to Zion, staying at the Motel 6. They got free Wi-Fi. Living large. Now, what was I talking about? Oh, yeah. No, not really. But that was good. Okay, watch. You weren't. I wasn't. I'm talking about the, watch. 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 Do you remember when you learned these gas laws in chemistry? Do you remember this? Yeah. What's Boyle's law? It's a law that Boyle invented. All right, we're going to leave that one alone then. You got it. Nice. Jimmy, he comes out of nowhere and boom. Right. He just comes in, sits down, and boom. Volume over pressure. All right. Now get this. Boyle said that if you increase, we're talking about the body now. If you increase the volume of your lungs, what cavity do the lungs sit in? Please get this right. Nice. See, that's where those, yeah. If you increase the volume of the lungs, you will decrease the pressure in the thoracic cavity. If you get this right, I'm going to be proud of you. Where's your heart? I'll give you that. Mediastinum, what's the big cavity that it's in? In the thoracic cavity. Say yeah. How many people had a baby? How many people, when you brought your baby home, did they give you the little blue booger squeezer? So if your kid got a goog, what did you do? How did you suck it out? What did you do to the little blue bulb before you stuck it in the kid's nose? You squeezed it. Then you sucked it in the kid's nose, and as the bulb expanded, it sucked the booger out. Ain't that right? Can I tell you what love is? I'm going to give you the true definition of love. Listen up, because this is true. It's almost the 14th. My son, when he was born, he was 4 pounds, 2 ounces. He was about 2 months early, right? So he had to stay in the hospital till he was 5 pounds, right? So I was feeding, and watch, when you become a parent, anything you know goes out the window. You don't know anything. You immediately become an idiot. So I know that infants are obligatory nose breathers. If you cover the kid's nose, you pinch their nose, they'll suffocate. They don't know that they can breathe through their mouth. Did you know that? Well, you learned something again. So the only way they can clean their airway is to sneeze. So my kid sneezes, and I'm like, he's got a cold. Oh, no. So I'm walking around to a nurse. He's got a cold. And it's like, he doesn't have a cold. And then I thought, I'm like, yeah, you're right. Then I'm feeding him, and he starts hiccuping. So I'm like, oh, my God. So I'm looking for a nurse. He's hiccuping. And then she looks at me, and she goes, do you hiccup? And I'm like, what up? Right? That's why pediatricians won't take care of their own kids. They are too close to the situation. You immediately become an idiot when it's your kid. My kid got a fever. He's like 2 years old, gets a fever. I'm like, what do I do? What do I do? So what do? I call my mom. I go, Ma, Bailey's got a fever. What do I do? She goes, you're a nurse. You know what to do. And I go, oh, yeah. That's exactly what I said to her. Oh, yeah. And then, you know, yeah, I just rub some dirt on it. Okay, so watch. Watch. Are you always contracting your legs? Are quadriplegics and paraplegics contracting their legs? Do they get venous blood back to the right side of their heart? That's because the heart is in the thoracic cavity. And watch. When you take a breath in, what happens to the pressure inside the thoracic cavity? We just went over Boyle's law. When the volume goes up, the pressure goes down. And your diaphragm, when you contract your diaphragm, it squishes your organs. So it puts the venous blood in your abdomen under high pressure and the right side of your heart under low pressure. And where do things always go? High to low. So it's the breathing, the mechanics of breathing that allow venous blood to get back to your heart. Now watch, and this is the classic example. This class, right? This class, you're like, this sucks, right? You're like, is it time to go yet? And I get it, because I look at the clock too. You know what I'm going to do one day? Like when you're taking a quiz or something, just a short one, I'm going to go up there and change the clock to an hour and a half faster. So watch. When you're not moving your legs, you have to maintain blood flow to your brain. And when your muscles become relaxed, they don't get venous blood back to the right side of the heart. So you want to make sure you get that venous blood back to the right side of the heart, so you maximize your thoracic pump by yawning. And yawning increases that venous blood back to the right side and more blood to your brain. Tell me you got that. That's why people yawn. Or I don't know. Well, actually I do. Back in the day, they didn't have like clocks and, right? So the mom would begin to yawn, and then the kids would see the ma yawning, and they're like, okay, it's time to go to bed. I could have sold that. I could have. How many people follow that? So the two ways that venous blood gets back to the right side of your heart are through the contraction and relaxation of skeletal muscle and the one-way valves in veins, yes, and the thoracic pump. Now watch. I know what your tendency is. I'm going to cut it off, right? If you write the thoracic pump and you don't explain it to me, I'm marking it wrong. Do you got that? If the question says explain, I want it explained, right? It doesn't say list, right? It says explain. Say yeah. Have you ever seen somebody pass out? Right before they pass out, they try to maximize the thoracic pump. So as they're passing out, this is what they do. They go, they start sucking air trying to get that venous blood back to the heart. Say yeah. You've ever seen that happen? What's that? You've never seen that. You're kidding me. You don't see them sucking air? You're not looking close enough. You're probably updating your Facebook status. They're going down. Do you draw to update your Facebook status? Oh, do you draw blood? Yeah. So you know about the vasovagal response? Young, healthy people, if they don't like needles, they don't like needles because they passed out. That's why they don't like them. Have you ever passed out? It's kind of a cool feeling. It actually is. Like, you know you're going down, and you don't care. Right? You're going down, right? But I don't care. All right. How many people followed that? Guys? Guys? How many people followed that? All right. Here we go. The next thing I'm going to go over, and I'm telling you this right now, it is not that big of a detailed explanation, but I want as much detail as I give you because it's so important. This question that I'm about to go over is worth 150 points. And it's not that big of a detailed explanation, but you better nail it, right? Or big points are taken off. For little errors, big points, because it's so important. Say yeah. What's the goal of the cardiovascular system? What's the goal of the body? We'll work there. Good. The goal of the cardiovascular system is to maintain blood flow. And what's the most important part of your body to maintain blood flow to? And your core, your brain and vital organs. So again, your body will sacrifice blood flow, oxygenated blood, to non-vital parts to make sure that you maintain blood flow to your brain and vital organs. Are you with me? All right. And at rest, the average adult pumps about 5 liters of blood each minute. How many cc's is that? Good. I was worried. Do we pump all 5,000 cc's at once? Do we? Yes or no? Yes, no, I don't know. Yes? If we did, we would have a left ventricle that was like this big. Right? So if we contracted all at once, you'd be like this. It's contracting. Okay, here it comes. Right? And you'd be like, right? And then right near the end of me, you're like. Also, we could have like a little cart that carried that big oversized left ventricle. And you could have some wheels on it, right? And then you'd have to pull it along. Then as you got older, made a little money, you could put some rims on it and some spinners and put some lights on it. Anyways. So we don't pump it all at once. We pump a little bit over that entire minute. So watch. When you feel somebody's pulse, you are actually measuring the number of times the left ventricle contracts. You knew that, right? You knew that, right? Yes or no? Good. So watch. Blood flow is really determined by your heart rate, the number of times your left ventricle contracts. You got me? Multiplied by, excuse me, and I'll show you in a minute. the amount of blood ejected with each beat of your heart. And the amount of blood ejected with each beat of your heart is called your stroke volume. Are you following me? Let me explain. Right? Stroke volume, the amount of blood ejected with each beat, and then you multiply that times the number of times your heart beats. So observe. Hang on, I got to find the spot. Which side of the heart pumps more blood, the right or the left? Somebody's gonna get that wrong. Watch. The right and left side of the heart pump the same amount of blood. Which contracts first, the right side or the left side? No. You've been tricked. They contract at the same time too, right? So watch. As venous blood from the right side is being pumped to the lungs, at the exact same time, oxygenated blood from the left side is being pumped to the cells of your body. Are you following this? So watch. As the ventricles, the right and left ventricle contract, the number of times they contract is your heart rate, and then they eject a certain amount of blood with each beat. So observe. Boom. You got me? And each beat of your heart ejects a certain amount of blood, and the amount of blood that's ejected with each beat of the heart, left ventricle in this case, is called your stroke volume. Are you with me? What's the average heart rate at rest for an average adult? So we'll say it's 70. So 70 beats. Are you with me? Here comes some factor cancellation coming at you. Remember that chemistry stuff? You love that. Bet you when you heard there was math and chemistry, you're like, I'm taking it twice. I'm failing it the first time on purpose so I can take it again. Wasn't that right? So how much blood is ejected by the heart each minute is determined by your stroke volume. What's stroke volume? What is it? No. Stroke volume. The amount of blood ejected with each beat. Amount of blood, you're writing it. Ejected with each beat. And times your heart rate. And that's the number of times the left ventricle contracts each minute. Say yeah. What's the average amount of blood the average adult pumps each minute? 5,000 cc's per minute, right? And that is determined by taking your heart rate times your stroke volume, or the amount of blood ejected with each beat. Who's with me? So if you take the normal heart rate, which is 70 beats per minute, times the amount of blood ejected with each beat, and the amount of blood ejected with each beat is about 70 cc's per beat. So every time at rest, your little left ventricle contracts, it pumps out about 2.5 shot glasses full of blood, giving you something maybe you can relate to. Volume. You got that? So if you take 70 times 70, the beats cancel out, and you're left with 4,900 cc's per minute, or approximately 5,000 cc's. Say yes. Totally got that. That concept of how much blood is pumped by the heart each minute is called cardiac output. That's how much blood is pumped by the heart each minute. And it's determined by your heart rate and the amount of blood ejected with each beat of the heart. So how do you know your heart is pumping more blood? How do you know that? Your heart rate goes up. If your heart rate goes up and you're not bleeding your own blood, your heart is pumping more blood. Say yeah. Okay. How many people are with me? You followed this? Guys, yes or no? This ain't bad. All right. Watch. What's the heart made out of for the 1 millionth time? And what are the two things that muscle can do? So when it contracts and ejects blood out into the systemic arteries, what's that pressure called? It's called your systolic blood pressure. Say yeah. Systolic. Systolic. Yeah, I got it. How many people are with me so far? This next thing I'm going over, 150 big ones, no little ones. Right? This is going to be question 2. Systolic, diastolic, then this one. So if you get these 2 wrong, forget about it. Seriously. I'm giving you the stuff too. And you figured it out now. I give you the questions and teach you the answers. I had a student, she sits right there. She goes, Tim, you have the perfect formula for success. I'm trying to tell you. Okay. Watch. Please get this. Blood flow. Blood flow is abbreviated Q. So once you start reading medical stuff, if you see Q, it's relating to flow. In most times, it's relating to blood flow. Your blood flow, how much blood is pumped through the cardiovascular system, the arteries of your body, every minute, is determined by your systolic blood pressure divided by, an equation. Divided by resistance to arterial blood flow. If you recall, that was one of the first things I did in class today. I said, if you were blood, which would you rather flow through, artery A or artery 2? And it is what? A. Because artery A has a bigger diameter and therefore has less resistance to blood flow. Are you following me? So as the artery diameter gets smaller, it's more difficult for that arterial blood to get through that artery. Say yeah. God, you know what? I take that back. I lied. It's not worth 150. It's worth 300 points. 300, right? It's that important. If you get this, it's going to be good for you. If you don't, I don't even know. Doesn't matter. Do you know why? What are the resistance vessels? The arteries. You got me? What are arteries mostly made out of? What are the 2 things that muscle can do? You're saying this like this is boring. Is it? Do you for real? Good. Okay. Then I'm going to run through this 300-point question, and yep, it's going to end poorly. No. I'm going. I got to get home. What's the goal of the cardiovascular system? How much blood does the cardiovascular system pump each minute? What is 5,000 cc's or 5 liters determined by? It's determined by your systolic blood pressure divided by the resistance to arterial blood flow. And what determines resistance to arterial blood flow, ladies and gentlemen, is the diameter of the arteries. Say yeah. Now watch, right? Now I have to go through this. If you want, you can drool in those little sinks because you will stroke out probably. I want you to do that, right? Because it's a math problem. So here we go. What's normal systolic blood pressure? 120 millimeters of mercury. What's normal resistance to arterial blood flow? Is that the new math? Because 24 into 120 is 5 in any language. Right? This is where I should slow down, but I'm not. Because you hurt my feelings. Because I went over it. And I'm stopping the recording too, because it hurt my feelings really bad. Ready? Watch. That means that the average size of your arteries, I'm making this up, throughout your body is this big. Are you following me? When I was 20, I wanted to be a fry cook. So I had to get a physical to be a fry cook. When I was 20, I had to pump 5 liters of blood, didn't I? Yep. So if I ever see you like a Pick and Save or maybe Woodman's, and I say, what are you doing? You can just say, pumping 5 liters. So watch. I still had to pump 5 liters. And the doctor took my blood pressure and he said, Timmy, your systolic blood pressure is 120. That's good for you. And I was very happy. And I went home with a big smile on my face. So what is the average diameter of the arteries throughout my body? That diameter was 24. So all of my arteries were this big. You know this, so I'm just going to move on. I'm 54 now. Life didn't turn out the way I wanted, right? Got divorced, lost a lot of money, got an ungrateful kid, and I'm teaching at a technical college, right? Do I still have to pump 5 liters of blood per minute? Yes, I do. But I went to the doctor the other day, and the doctor said, Timmy, your systolic blood pressure is 240 millimeters of mercury. And he said, that's bad for you. So over the last 34 years, what has happened to the average size of my arteries throughout my body? They have gotten what? They have gotten smaller. Tell me you got that. They have gotten smaller. Say yes. What's the most important element in muscular contraction? Where does the heart and arteries get its calcium from to contract? And this is the blood, so where would calcium be? In the blood. Can calcium from the blood willy-nilly go into this muscular wall of the artery? No. How does it get in there? Please get this right. How does it get in there? Hit her. How does it get in there? See, this is based on previous learning. That's working out well. I'll give you that. Can calcium simply diffuse? So in order for calcium from the blood to get into that muscular wall of the artery, it has to go through a specific calcium ion channel. Ain't that right? And when calcium goes through a specific calcium ion channel, it will cause the muscular wall of the artery that was this big to contract. And what will happen to the diameter of that artery? It will get smaller. So what will happen to resistance to arterial blood flow if the arteries get smaller? It will go up. And what's the goal of the cardiovascular system? To maintain blood flow. So if the arteries get smaller throughout your body, what has to happen to your systolic blood pressure to maintain blood flow? It has to go up. So now Timmy got high blood pressure. Oh, yeah. Oh, yeah. So the doctor says, Timmy, don't worry about it. I got degrees and stuff. Look at my wall. I'm going to give you a medicine that blocks calcium ion channels in your arteries. And when the calcium ion channels are blocked, the artery can't contract. It will dilate. And when the artery dilates, what happens to resistance to arterial blood flow? It goes down. And to maintain Q, what happens to your systolic blood pressure? It goes down. Is there a medicine that blocks calcium channels in the muscular wall of arteries? Yep, they're called calcium channel blockers. Have you ever heard of Norvasc, Cardizem, Procardia, Verapamil? Have you ever heard of those? Those are all calcium channel blockers. Bam. Timmy just taught you some pharmacology. But those calcium ion channels are not important. It's all about the patella. Say yes. So watch. Doctors control blood pressure by controlling the diameter of arteries. If your blood pressure is low, they're going to give you a medicine that causes the arteries to constrict. You don't think that's cool? It's fantastic. 300 big ones, no little ones. I want that whole thing. So let it be written. So let it be done. Okay, take a break. You earned it. I got 6 more years.
You ever do an open note quiz?
No. Actually, if you want to see me have a seizure, recommend that.
No, I'm just asking.
The answers are on the notes. You'll copy them down.
What?
Is anything expected in other classes? I didn't think so. So they come in here and this is like complete culture shock. All right, here we go. Here we go. All right, how many people understood Ohm's flow law a little bit? A little bit. So remember, as we review, what are the resistance vessels? Nice. And what are arteries and veins mostly made out of? That's good. Right. If you write that, and you don't know an answer to a question, and you say muscles contract and relax, I will not take off all the points. That's a fact. Because you learned something. Right? Okay. What I'm going to do for you now, and I don't know if you know this. Am I? Yeah, I am. Okay, wait. Where is this? I got 13 emails and then one from Eric. That's just great. Oh, you know. I'm trying to copy that guy's swing. Mo Norman. That guy's a pimp.
You mentioned that you said 5 more points, right?
If you mention Mo Norman?
Yeah.
How can you remember that?
And the Oracle and Neo. How about we have those three
Slow motion number 7.
Slow motion?
Slow motion number 7.
What is slow motion number 7?
Norman, slow motion number 7.
Oh, that was just a picture. She took it too literal. She took that exactly.
If I made this class all extra credit, you guys would be like Rhodes Scholars.
Yeah.
It's just amazing how you just clam on to that extra credit. It's unbelievable. Well, you wouldn't need it if you didn't think about it and just study the stuff I gave you.
I did, and I still got
And you did bad?
I got a B.
Well, B's get degrees, sister. C's don't get degrees no more, but B's do. Do you know what you call a nurse who graduated the last in their class? Nurse. You don't have to be the top in your class. In fact, I wouldn't want that. I want a nurse that got C's all the way through, especially in pharmacology. So they give me the wrong drug and end my pain. Okay, here we go. Listen up. Listen up. Here it is. Sarah, write this down literally. Circulation of blood through the heart. It's got 32 views in 3 months. So that's 10.125 views each month. Wonder who was the 0.125 reviewing it. Looked at it. No. Watch. So I'm going to go through the circulation of blood through the heart, but you have this beautiful video that I put together just for you. Isn't that nice? Watch. And I'm never telling you this again. If you ever say anything, Tim, where's circulation? I'm like, I don't know what you're talking about. Then there's a video on the electrical conduction system of the heart. We learned when we talked about electrolytes, I'll never forget it. It was a Tuesday. Got me? You told me that electrolytes produce electricity in the body, and the two systems that use it are the heart and the nervous system. Ain't that right? Never forget it. So the heart can generate and sustain its own electrical activity. Watch it. When they do a heart transplant on someone, do they have to transplant the person? Do they have to take the donor's brain and spinal cord and transplant it into the patient? They transplant the heart. And the reason they can transplant the heart is because the heart can produce its own electrical activity. Isn't that cool? Say yeah. I can see you guys are just excited. Them Duke boys got my money. All right. That is a non sequitur. It means nothing. It is complete nonsense. It's what's referred to as a flight of ideas, right? Something. Them Duke boys got my money. It's meaningless. Did you ever watch Dukes of Hazzard? It's a great show, right? Those were some highly skilled actors. No. Oh, well, I'm sure. Who's got the cardiovascular quiz? Anybody? I see it. What do you got there? What's that? A what? What is it? Oh. All right. Okay, let's do something easy. All right? Can we do that? Did I tell you I had one of the other instructors? She goes, Tim, why do you care so much? And I'm like, I don't know. You ever see The Office? The movie The Office? I didn't either. I'm going to go watch it. Okay, watch. You cut open a heart. Remember that? Didn't this class do that? Yes. Good. All right. So the heart consists of 5 layers. I'm going to go from outside to in. You got me? Remember, all organs of the body have a big sac that the organ is housed in. The heart is no different. The sac that house or that heart is housed in is called what? Nice. That is unbelievable. It's called the pericardial sac. The pericardial sac has another name. It's called the parietal pericardium. You got me? And these membranes that make up the linings of these organs, the lungs, and in this case the pericardial sac, are referred to as serous membranes. I'm sure you read that in your book when you read the chapter on the different tissues. You were all over that like a cheap suit. Now, watch. Serous membranes secrete fluid. And this fluid will actually lubricate the organ from the cavity. So the organ isn't rubbing on the cavity. These linings aren't rubbing on one another. Otherwise, you can get friction, and that will lead to an owie. So in this case, you can get a condition called what's called a pericardial rub or pericardial effusion. Have you ever heard of this? I'm assuming that you probably, one of you at least, has a kid named pericardial rub or pericardial effusion. Come home and read your book. All right, can I tell you a real quick story or no? Okay. I used to do home care in Milwaukee. And one of the things that can happen if you smoke crack. Oh, about the lady who the husband came or the boyfriend came? Anyways, now forget it, man. It's over. It's completely lost. Well, do you want to hear the story or no? Yeah. Anyways, I did home care in Milwaukee. This lady smoked crack. What does crack do to you? What does it do to you physically? I'm writing that down. What else? What is it? How does it make you feel? How do you know? It hypes you up. You got me? Right? So people's heart rate and blood pressure are higher. And what happened is she created what was called a pericardial rub and pericardial effusion. She also developed what's called endocarditis, bacterial endocarditis. She started developing bacteria on the leaflets of her valves. That's bad for you. So I would have to go over and give her IV antibiotics every day. And these were some serious antibiotics. Have you ever heard of vancomycin? Right? That stuff causes blindness and liver disease and laboratory animals. I mean, the stuff's a mess. So I said to her the first day I show up at her house, I said, look, you have to get comfortable because we're going to be here for 3 hours. You got that? So I go, where do you want to do it? Oh, you can do it in my bedroom. So I said, just lay down. And she had a central line going directly into the right side of her heart. So she had no problem just whipping her robe open either. I'm like, okay, let's wrap that up. Anyways, that was a Friday, the first day I went there. The second day was a Saturday, and I came about like 11 o'clock in the morning. And her bedroom was right off the front door. And I look, and I see this giant hole in her bedroom door. I go, what happened? Oh, my boyfriend came over, and he got upset, so he took a shotgun and blew a hole in my bedroom door. I'm like, I can see that. Where is he now? Well, the cops came and he took off. How long was that antibiotic supposed to go in? 3 hours. That thing went in 20 minutes, right? She goes, isn't it going in fast? No, it's Saturday today. Goes in faster. That's no joke. That is no joke. Yeah, I saw a guy. This is back in the 80s when the oil was still big in Texas. This guy sold his company, and I don't know what it was, but he became like a gazillionaire overnight. So him and his buddies are out partying, and he's snorting cocaine, right? He must have done a lot of it. He was a portly dude, overnourished, and he came into the emergency room, and he was stone cold dead. And he was a young guy. So the ER doc says, we're going to separate his ribs, and we're going to try an open cardiac massage. So he looks at me, he goes, you ever do that? I go, yeah, last Tuesday. We got a club that we do. I do that all the time. I'm like, no. So he says, get a sterile glove on. I'm going to spread his ribs and get in there. And when I got in there, there was literally a hole in his left ventricle. He blew a hole in his left ventricle. And that guy was dead. He was a millionaire. Then he was a dead millionaire. I know. It's terrible. I know, but here's the thing. He never left any of that money to me. He's a hater. How many people follow that? Okay, so look. If you look at this, this is a little better. Not really, but it's in the slide. So you have the visceral pericardium, right? I'm sorry, the parietal pericardium, the thick, tough sac. Then you have the pericardial space, and then you have the thin saran wrap that covers the heart directly called the epicardium or visceral pericardium. Visceral pericardium and epicardium, the same thing. Say yes. And then you have the thickest part of the heart, which is the myocardium, the muscular wall of the heart. And then you have this delicate layer that lines the inner chambers of the heart as well as the valves. And that is the endocardium. So that is inside to out. What? It's on the tape. For real. I've got to get going. I got a lot of stuff to say. This is what I wanted to show you. Look, there's valves in your heart that separate the atria from the ventricles. You got me? And those valves are connected by these little strands of protein called chordae tendineae. Those strands are then embedded into the walls of both the right and left ventricle by papillary muscles. So when the left and right ventricle contract at the same time, the papillary muscles contract and they will stretch those chordae and prevent the valves from leaking. Have you ever heard of mitral valve prolapse? Have you heard of that? What does that mean? It means where the mitral valve is prolapsed. Are you writing that down? Let me just show you this. If you look here, watch. When the mitral valve is closed, when it's closed, it closes like this. It closes like this. Boom. You follow? Prolapse means inverted. So people who have mitral valve prolapse, the mitral valve doesn't close like this. It closes like this. And that's a very weak position. So you don't know this yet, and you will in a minute, but watch. Where does the blood in the left ventricle want to go? It wants to go into the aorta and out to the cells of the body. Does it ever want to go back into the left atrium from where it came from? Do you ever want that to happen? So if you are eating some Kellogg's Sugar Smacks, dig them, and you eat it, gets into your stomach, and then it comes back out, that's called what? That's called regurgitation. So if you have mitral valve prolapse, when the left ventricle contracts, some of that blood in the left ventricle, ventricle can go back into the left atrium. So you have mitral valve prolapse with mitral valve regurgitation. It's quality education. That rhymes. Regurgitation, education. All right. If it's bad enough, that valve has to be replaced. In women who want to have a baby, and they can't because they have mitral valve prolapse with the regurgitation, they have to go and get that valve replaced before they can have a baby. Because being pregnant is analogous, the effects on your cardiovascular system is like running a marathon 24/7 for 9 months. That's no joke. The body does stuff that makes sense, and if the woman's body is not able to physiologically and anatomically handle a baby to term, that baby will not, the body will abort it. If you're diabetic and you're a woman and you ain't controlling your blood sugar, you ain't getting pregnant.
Is that where they use like the pig valves for replacement?
Yeah, they will use pig valves. Some of the people then become very, very messy, and then their nose starts going like this. There's the other one, it's called the St. Jude valve, and those people become very nice and go into religious studies. St. Jude valve. Do you know what about the St. Jude valve? You know how that works? Well, you can learn something in clinical. I can't teach you everything. I don't care. I don't care what they do. I care what I do. It's all about me. Ian and me and Timmy, no you. Remember that? Can I show you this just real quick and then you can ambulate home? This is worth the wait, for real. This is my YouTube page. Who's complaining over there? Anybody complaining?
No, I was saying how I know your YouTube page very well.
Okay, wait. What was I going to show you? Oh, here we go. People who have mitral valve prolapse, the electrical conduction system of the heart is very close in proximity to the mitral valve. So when the mitral valve prolapses, it can actually affect the electrical conduction system of the heart and cause people's heart rates to race. You get these tachyarrhythmias associated with mitral valve prolapse. So these people are very concerned. So what they do is they go to mitral valve support groups and they talk about it. Hi, I'm Eric and I have mitral valve prolapse. Hi, Eric. Wait, how do you spell valve? Right? See? Mitral valve support groups. Right. So if you have mitral valve prolapse, they're meeting March 18th. Oh, 2010. That was 6 years ago. A little late. There's a support group for everything, just so you know. Right? The internet's out there. Clearly, there's not a support group for people who take general A&P at Gateway Technical College.
This is our support group.
Yeah, how's that working out for you?